Good day to all. Now we will be briefly discussing disorders of the immune system. Tissues of the immune system are grouped under primary or secondary immune tissues. Among the primary immune tissues, the bone marrow, hematopoietic stem cells will differentiate into either lymphoid or myeloid cells. Each will give rise to the different types of white blood cells, as seen here in this slide. Each of these cells have roles or functions in the immune system, and are enumerated in the next slide. Immunity can be classified as innate or adaptive. This table shows the characteristics of each. The next two slides will present what cells are primarily involved in either the innate or adaptive immunity, as well as the cells that have overlapping roles, and the different types of lymphocytes. Here is a simplified way of the immune system response in the presence of an antigen. In particular the T and B lymphocytes and the dendritic cell. In both images, it is the T helper cell or CD4 lymphocyte that directs the next step on how to destroy an antigen. Now, briefly, the major histocompatibility complex and the complement system. The major histocompatibility complex or MHC are of two classes. Class 1 MHC and Class 2 MHC. The MHC is a group of genes found in chromosome 6 and are responsible for how the immune system recognizes what is an antigen and what is not. It is how the immune system makes sure that normal tissues will not be attacked by the immune cells. The complement system are a group of proteins that when activated help in enhancing the immune response, including inflammation. You have been given a short review of the immune system and its components. The knowledge of this is very important in understanding what will be discussed next: immune disorders. Disorders of the immune system can be classified into hypersensitivity disorders and immune deficiency disorders. First, hypersensitivity disorders, which are classified as follows. Type 1 or immediate hypersensitivity disorder. Type 2 or antibody-mediated hypersensitivity disorder. Type 3 or immune complex-mediated hypersensitivity disorder, and Type 4 or delayed type hypersensitivity disorder. This slide shows the mechanism and examples of each classification. When discussing hypersensitivity disorders, autoimmune diseases are classic examples. Autoimmune diseases are the definition of how the immune system has failed to recognize normal tissues from antigens or abnormal tissues. And a very good example of an autoimmune disease is systemic lupus erythematosus or SLE. This autoimmune disease, as the name implies, affects multiple organ systems and is characterized by the presence of anti-nuclear antibodies. The next slide will show other few examples of autoimmune diseases. Finally, immune deficiency disorders. These are classified as primary and secondary. Primary immune deficiency disorders are further classified into innate and adaptive. There are many immune disorders under the innate primary immune deficiency disorder. Chidiac-Higashi syndrome and chronic granulomatous disease are just a few. Among the more common adaptive primary immune disorders are Bruton disease, Wiskott-Aldrich syndrome, and SCID. Secondary immune deficiency disorders is best exemplified by one disease: AIDS. AIDS is caused by a retrovirus called HIV. As mentioned earlier, the CD4 helper T lymphocytes are very important in the regulation and function of other immune cells. The CD4 cells make sure that the immune system functions and protects the host from infections. The CD4 cell levels must not fall below 200 or opportunistic infections will set in. It is not the AIDS that will kill the patient, but the infections that uses the opportunity that the patient no longer has a functioning immune system. That ends our brief discussion on disorders of the immune system. The next and last topic of the midterms is genetic disorders. Thank you for your attention.